Hello, my name is Kristen Connect, and I'm president of Head, Shoulders, Teeth, and Tongue, a myofunctional therapy clinic. Today, I'm going to answer the question, how do I know if I need myofunctional therapy? How do I know if it's going to help me? Now, this is a really important question because I work with people who don't sleep well, if they are snoring, if they are not sleeping through the night, they're waking up multiple times, if they have mild sleep apnea or even moderate sleep apnea. I work with people who have jaw pain. I work with people who are clenching or grinding their teeth. I work with people who have lost dental implants because they've been grinding their teeth so much that their dental implant literally broke and they had to go get another one, and that's super expensive. I work with people who have jaw tightness. I work with people who have jaw popping and clicking. I work with people who don't swallow very well. They've noticed maybe that they just struggle to swallow their vitamins and they struggle every single time. And they're like, man, does everybody struggle like this? No, everybody does not struggle swallowing vitamins. It's actually pretty simple for most of us to swallow our vitamins. So I work with these people to help them with their muscles. Myo means muscle and function is the function of those muscles. So I'm working with all of the muscles in this area. And then we work just a little bit with the muscles in the neck and in the shoulders just a little bit to support the muscles in this area. We want them all working together. They are all integrated. So how do you know if orofacial myofunctional therapy is going to be the thing that helps you sleep better, reduce your jaw tension, reduce your neck tension, allow you to swallow better, get rid of clenching or grinding your teeth, help you stop snoring, help you, sleep more rested, all that kind of stuff? How do you know? Well, there's a few things to check. One, you got to check to see what your muscles can do. Can you point your tongue for 10 seconds without the help and support of your lips or teeth? So it would look like this. Now, I'm not doing this, right? That would be using the support of my lips. I'm not doing this. You're having to hold your tongue with your teeth in order to get it to point and stick out of your mouth, and hold it real still and straight if you're pointing like this. If your tongue cannot create the shape of a bowl. So you go in for a massage, and that massage therapist goes through all of your head muscles, and you're like, oh my goodness, that is such a relief. If you're getting a lot of relief from a massage of your skull, probably not using those muscles correctly, and your jaw is experiencing jaw tension, jaw strain, jaw tightness, and that can eventually lead to jaw pain. But the problem is that even before it gets to jaw pain, you're probably not using your jaw correctly. Maybe you're avoiding hard foods like steak, like raw vegetables. One other way to test to see if you need myofunctional therapy is to do a smile swallow. So if you take some water and you can keep your lips open without any strain in your lips, they're just gently open, and then you can use your tongue to do the swallowing, and you don't feel like you're going to choke, you don't feel like you're going to lose the water, or you actually do lose the water. So what you do is you take a little sip of water and swallow. Now that water was cupped in my tongue. I swallowed. The water went down my throat. I did not need my lips. The water did not come shooting out of my mouth. The lips did not become very tense. You can see the tense muscles. I see that all the time. Or people's lips will come in. It'll look like this. Right? Because they know they're going to spill the water because they don't know how to use their tongues anymore to swallow. So it's really, really important that the tongue do its job and that the other lips of the face not compensate, because we swallow 500 to 1,000 times a day, depending on the study that you read, and it is supporting our jaws all the time. If you're swallowing correctly, it supports your jaws. If you're not swallowing correctly, it's not supporting your teeth or your jaws, and that can lead to dysregulation of the jaw joint itself. It can lead to crowded teeth. It can lead to an open bite or a cross bite. It can lead to all sorts of different things. And most importantly, in my opinion, it can lead to crowding or narrowing of the jaws because the tongue is not supporting the bone. And so the jaws don't get the pressure from the inside to stay wide and hold that space for the tongue. And then the tongue has less space, and then the tongue moves back into the throat, blocking off that airway some or completely. And so working with an orofacial myofunctional therapist helps to retrain all of the muscles to support the jaws the way the jaws ought to be supported, so that your airway can stay open, so that you can sleep better, so that your life can be happier. So I hope this gives you a little bit of clarity on how it could help you and a couple of things that you can test on your own. I hope that you find the answers that you are looking for.